All right, so personal and community health, diseases. Part of our personal health and community health has to deal with diseases. So the definition of disease is an illness or something that's abnormal bodily condition that interferes with normal functioning and can usually be recognized by signs and symptoms. We have two different types. We're going to start with the communicable diseases. Communicable diseases are illnesses that are caused by pathogens. Certain pathogens are virus, bacteria, and parasites. Viruses actually cause most diseases. They attack and survive by invading a cell. Some of them include your cold, flu, rabies, chickenpox, measles, polio, pneumonia, and mono. Then you have bacteria. They are tiny one-cell organisms that can live anywhere. Certain diseases that are caused by bacteria, you got your strep throat, food poisoning, Lyme disease, pink eye, tetanus, etc. Then you have your parasites. Gross. Anyway, so you have worms or mites that actually burrow into the blood supplies of victims. Tapeworm and lice are some examples. So how do we get these communicable diseases? Either through direct contact, so that's coming in contact with an infected person, hand-holding, kissing, touching, that sort of thing. Indirect contact is coming in contact with germs left in the air or on a surface by an infected person. Okay, so touching doorknobs, desk, that sort of thing. Non-communicable diseases. So non-communicable diseases are illnesses that are a result of unhealthy choices, genetic conditions, or exposure to hazardous substances. Also known as chronic diseases, which chronic diseases are things that last for a long duration or have a general slow progression. There are certain risk factors that actually increase the probability that a person will get a disease. Unhealthy life choices like alcoholism, obesity, cancer, heart disease. Those are some of the things that can actually be caused by unhealthy life choices. So clearly alcoholism by drinking a lot of alcohol, obesity, eating too many calories and not burning them off, okay? Genetics, you've got your Down syndrome, Parkinson's disease, autism, diabetes, so things that we're born with that we can't necessarily do anything about. Age-related, dementia, Alzheimer's, cardiovascular disease, osteoporosis, all which affect older human beings. Cultural, some depend on what our background is, our genetic makeup, okay? Sickle cell anemia, which is a condition or non-communicable disease that actually runs more in African Americans. Cystic fibrosis, again, it's another condition that happens to affect more of your Caucasian descent or European descent human beings. Exposure to hazardous materials. So what are you exposed to in your environment? Things you can get from that: skin cancer, asthma, COPD, which is chronic obstructive pulmonary disease. So skin cancer, overexposure to the sun, not taking precautions there. Asthma can actually be environmental as well, okay? So, again, to reiterate, non-communicable diseases, how they're contracted: unhealthy life choices, smoking, drinking, living a sedentary lifestyle, which means inactivity. Genetic, what makes up our DNA? And environment, what are we exposed to? So let's test here. What are communicable and non-communicable? Common cold, drug addiction, cancer. So your common cold would be your communicable disease, okay? Whether it's direct contact or indirect contact, that's how you would get that one. Drug addiction, that comes from an unhealthy lifestyle choice. Cancer, again, you're non-communicable because, again, it could be an unhealthy life choice, maybe a sedentary lifestyle, poor diet, potentially, too much smoking, or using drugs that could actually lead to different kind of cancers. So again, common cold, communicable, drug addiction, and cancer, your non-communicable examples. Okay. So some things to think about. How does knowing about diseases help you with your personal health? How do diseases impact my community? And what risk factors can you personally control? So when you're thinking about diseases or, your personal health, or even when you're starting to think about what habits you can change, think about some of these questions and think about what part you can do or what behaviors you can do to actually help prevent disease. So, leading into how to actually control diseases. You have two ways. We've got prevention, what people can do for themselves and others to avoid the spread of disease, okay? Then we have treatment. What can people do to help secure or manage symptoms of a disease or condition once someone already has been exposed? So here are some good disease prevention practices. You have safe personal practices, like washing hands, cover coughs and sneezes, eating healthy food, get enough rest and sleep, exercise. Those should be all no-brainers at this point. Food safety. Refrigerate foods after bringing them home. Wash fruits and vegetables. Use separate cutting boards for meats and other food because bacteria can live in there and that can make us sick. Okay? Drug safety. Using medications as directed. Take antibiotics on schedule and finish the prescription. Don't share prescriptions with others and avoid, your hardcore street drugs there. Okay? Or recreation drugs. Environment. Clean and disinfect and destroy germs. Use disposable towels. Wash dishcloths and washing machines and sponges. So again, just kind of trying to keep your environment safe and clean. Age-related. Immune systems are actually weaker in elderly, so you got to be just knowledgeable about that. Vaccinations and flu shots. Vaccines actually help protect us and build our immune system to help prevent certain diseases from happening. Like the flu shot, for example, the polio vaccine, even HPV. Students stay home when sick. That helps prevent the indirect contact or direct contact. And you got to think about it, kids, especially younger kids, their immune systems are still developing. So you got to take in precautions there. So what happens if we do get sick? What are some treatments? So here are some treatments of common diseases. So allergies, there's medication, there's allergy shots, okay? Asthma, you can actually manage the stress. Sometimes stress triggers the asthma reaction. Monitor the condition, manage the environment, maybe medication like an inhaler. Cancer, there's surgery, there's chemotherapy, there's radiation. Cold and flu, you got your over-the-counter medicines, rest, stay well hydrated. Conjunctivitis, which is also known as pink eye, prescribed eye drops. Diabetes, exercise, diet, oral medication, insulin. Lice, your shampoo, lotions, medications to get rid of the parasite. And strep throat, antibiotics, which are prescribed. Okay, so we're at the end. What I want you to do, or if you think you need to, there's Quizlet there. You click on that link and hopefully you can peruse the flashcards, quiz yourself, test yourself, and hopefully you understand how diseases are spread, how you can impact and change whether you get sick or not. And if you do get sick, how to fix it. In the future, prevent it. Okay?